If you're a man who doesn't really understand the menstrual cycle, or not a man but still don't, or you have a man in your life that you want to explain it to but don't quite know how, then this video is for you. We'll go over what the menstrual cycle is in simple terms, how it works, and how hormones can affect women at different parts of the cycle, which will help you to understand why sometimes she isn't in the mood to be intimate, and when she will more likely be. So, firstly, what is the menstrual cycle? It is a cycle controlled by hormones, where every month the body goes through a series of changes to prepare itself for pregnancy. On average, the cycle lasts for 28 days, although some women can have shorter or longer cycles than this. Day 1 of the cycle is the first day of the period. This is the womb. A period, may also be called menses, is bleeding from the womb out through the vagina. This can last around 5 days, although again it can last shorter or longer than this. How does it work? These are the ovaries, the fallopian tubes, the main body of the womb, and the vagina. A period happens when the lining of the womb breaks down. In every cycle, hormones released from the brain tell the womb to build up its lining to prepare for a potential pregnancy. If the woman doesn't get pregnant, then there is no need for that thicker lining, so it breaks down and is released from the body as the period. So days 1 to 5 of the cycle is when this happens. Then, during the rest of the cycle, the womb lining builds itself back up in case of a pregnancy again and is maintained until the end of the cycle when it breaks down again. At the same time that this is happening, an egg is released from the ovary around day 14. The ovaries are full of follicles which contain the eggs, and every month one usually is released. It travels down the fallopian tube, and if it meets a sperm and gets fertilized, this results in a pregnancy. These cells will divide and grow bigger into an embryo, which will then attach itself to the thick lining of the womb and continue to grow into a baby. If the egg doesn't get fertilized by a sperm, then this will result in the thick lining of the womb breaking down as it is no longer needed. These are sanitary towels or pads. These are tampons, and this is a menstrual cup. They can all be used by women during a period to collect the blood. The pads are placed in the underwear, the tampon and cup are inserted into the vagina. So how can hormones affect women at different parts of the cycle? During the period itself, a lot of women can get pain and cramps. Some women can have extremely painful periods, particularly if they have a condition called endometriosis. They may feel more irritable, tearful, and sluggish. Towards the end of the period is when energy levels increase again as the hormone estrogen increases. This will continue until around day 14 when ovulation occurs. So this is the time of the cycle when women will have the most energy, the most motivation, be in the best mood, will feel the most sociable and open to trying new things, and have the highest libido. After ovulation in the second half of the cycle, this will all start to go down again. So what men might be interested to know the most? A woman's interest in intimacy will be highest from the last couple of days of her period onwards, and peak around ovulation, around day 14 of the cycle, and it will be lower the further you go into the second half of the cycle, so you will find you have to put more work in to get her interested during this time. In the second half of the cycle, some women can suffer from PMS, or premenstrual syndrome, where they experience symptoms such as trouble sleeping, bloating, breast tenderness, headaches, and becoming more irritable or angry over small things, especially just before the next period. This can be difficult to control due to changes in hormones, so it's not that she is just being moody. So this is something that happens to women every single month if they are having regular periods, from around the age of 12, on average, all the way until around age 50. So it is an important thing to understand for both men and women. Around age 50, periods will become irregular, and she will enter the perimenopause stage, which will bring another whole load of symptoms and can have a very big impact on her life. Watch the next video to find out more.